This is the Dr. Don Show. It's your health, it's your life on the Astral Radio Network. Now, back to the show.
Okay, I can tell some of you are breathing just a little bit too hard. Those exercises should not have fatigued you. And just a little tip, if you did stand up and you did do these properly, bending sideways, forwards, and backwards, you probably heard some snap, crackle, pop as you started to make these movements.
Is that okay?
I want you to know that's perfect. It means you're doing them right.
Okay.
People have the idea that, when they move part of their spine or body and they hear a popping sound. Now, this is a sound that has no pain after it and no loss of movement and function after it. Just, you're moving, something goes snap, crackle, pop. These sounds are not good or bad. They just naturally happen. When we talk about toes, knuckles, knees, ankles, wrists, and elbows, everybody knows about those. They can see them, they can feel them, they can touch them. And when they make snap, crackle, pop sounds, they don't look at their wrist and elbow and say, my God, is it falling off? These are normal things. So the key thing here is you have 20, just like you know about toes and ankles, they're bone joints. The spine, it's just 24 more bone joints. And you need to start including the concept that they're bone joints along with the muscle strength that we're going to talk to Ann about. Because you can do lots of stuff for core strength and all the health and function of developing those good body muscles. But if you're not getting that discrete, subtle movement of the skeleton in the 24 vertebrae, you're going to be frustrated because you may not be achieving everything you want.
And for anyone out there that would like a copy of our exercises and posture score sheet, you can email us, radio@bcchiro.com. That's radio, R-A-D-I-O, @bcchiro.com. We'll send that off.
So, Ann, if one of our listeners has some chronic problems, now's the chance for them to call 604-280-0650. Long distance toll free. If you're sitting over there in Nanaimo and you're watching the sunset an hour ago, or you're in the fog and the rain, it's 1-877-280-0650. Our registered massage therapist here represents 2,800 registered massage therapists in British Columbia. And if you have some questions about care, chronic conditions, severe pain, when should you see a massage therapist, call and ask Ann. She's here to help you tonight. Ann, what else are you doing in the community with your professional career?
I supervise the massage therapy students from the West Coast College of Massage Therapy at Connect Place Children's Hospice.
You mean the students are going to Connect Place Children's
Yes,
Hospice?
they are. Every Friday
Really?
I supervise them, yes.
And how did that relationship develop?
After I took the pediatric massage course with Tina Allen and the Little Kids Foundation, I was approached by my clinic manager and asked if I wanted to supervise that. And Susan Poitras, who is the counselor and coordinator there, she wanted to start a program at Connect Place called Caring for the Caregiver. So she wanted to bring in massage therapy for primarily the staff, the volunteers,
Right.
and the families of the children in the
It's
program.
stressful and tiring.
Yes, because the community there, I mean, you're dealing with children with life-threatening illnesses, and all the way from the ground up, from housekeeping staff to the kitchen staff to the counselors to administration, we all feel that responsibility to support the families. So it is really taxing emotionally on them. So it is trying to get them to take some time out of their busy schedule so they can recharge, to provide them
Right.
some downtime. And from that, we have actually been able to treat, when appropriate, some of the children who are in the program, which is probably the highlight of this outreach for most of us.
Now, my experience with in private practice with youth and children is that they're very genuine about what they feel. In other words, they don't have all this other text and information and rhetoric and stuff that adults get to hear about. They just know they're in pain, and they can feel and express the relief that you're providing them. So what are you seeing with these kids in terms of some? I mean, it's an incredible thing, the hospice service, but it's got to be emotionally tearing up.
One of my favorite stories is a child who had cancer and was palliative, and he was staying at Connect Place with his parents, and he would come in for massage every single week, and he was so excited. And one week there was Luongo came in to do a public service announcement taping, and all the kids were up really early waiting around for him, and Luongo was still, doing his taping thing, and this child had an appointment at, 11 o'clock. So 10:45 rolls around, and Luongo's still doing this taping, and
Now,
I'm
be
like,
nice to Luongo here, okay?
yeah, I know. Like, I mean, I love Luongo, and I said, okay, so, it's almost 11 o'clock and you haven't seen Luongo. Do you want to cancel your massage appointment? And he looked at me and he just said, I've seen him before. I want my massage. So that to me says that he really found massage rewarding, therapeutic,
Yeah.
something that he didn't want to miss, not for anything, not for anyone. And I think Luongo is, awesome. And he loves Luongo, but
I'm sure.
yeah.
Now, in the hospice setting, are you seeing certain kinds of symptoms occurring more often associated with certain kinds of conditions the kids are experiencing? Like, is there some kind of condition that sort of manifests more often in terms of stress and pain and discomfort that you're seeing? Or is it just across the board?
Across the board, I mean, it's really about providing some positive touch for the kids that doesn't involve taking a blood test or poking them, doing
All
some
the other
kind of,
necessary
yeah,
stuff.
all the necessary things that come with being ill.
Mhm.
And we're just there to provide them some kind of therapeutic touch that feels good for them,
Right.
that provides them comfort and helps them to relax, and they don't have to worry about anything during that time. Um, and that's all it's really about.
Have you had a chance to see what the after effects are, like the feedback from the other caregivers and the parents? I mean, after you've worked with these children, I imagine, like with anybody who's been treated and found some relief, their attitude, their relaxation. So tell us some of the things that you've observed or you think you've heard about how these children sort of function after they feel a little better.
Well, I had the opportunity to treat a youth who had severe back spasms, and she was the back spasms were so great that the only parts of her body actually touching the bed were just the tops of her shoulders and
Right.
her sacrum, just the base of her spine. She was in such extension,
That rigidity.
very rigid, and we turned her on her side. I worked a little bit on her back, and she relaxed and was able to, actually
That was a huge
relax
change.
into the bed. And the nurse
Yeah.
was just like, she's sleeping.
Wow.
And, it also is about reduction of pain medication. Like if we're able to provide symptomatic relief for pain, they don't have to take as much medication.
Yeah. And that's really important. All right. Well, you're involved in something else in the community as well. GF Strong?
GF Strong, yes. I supervise the students at GF Strong.
So your instruction with Let's Go Massage Therapy, you're taking students to a number of different clinical settings.
Yes.
That's a fantastic
Yeah.
opportunity for students going through their training, to be able to, not only learn in the classroom or in the clinic, but also to go to those different environments. That's fantastic.
Yeah.
Who's going to do this when you're in Vietnam?
I've got people to cover my shifts. I took
Okay.
care of that right away. So when I'm away, I'll only miss maybe 2 shifts at each place, and then I'll be back before the new term starts. So
What kind of conditions are you seeing or caring for at GF Strong with the students from the West Coast Massage School?
we have access to all of the floors. So we do treat patients with spinal cord injury, acquired brain injury, as well as there could be amputations. So it is a wide variety of patients.
I have some interest and experience in the area of amputations, and this causes huge structural as well as chronic pain issues too. But I would suspect that your profession is highly valued in some of these post-surgical environments because of all the sudden weight shift and mechanical functions and some of the contraction of muscle issues that have to be going on.
Exactly. You have to learn how to use your body in a different way. So
Right.
a lot of the times we are treating not the injury site itself. At times it's compensatory areas. So the muscles that, are forced to work much harder because of the lack of the missing limb, then that's some of the areas that we can definitely address and help the patient with.
So let's go back to the children again. How did you find out about the organization that had this overseas involvement with children?
Well, that foundation was who I took the massage courses through, and Every year she does take a group of 20 volunteers to different locations. She took a team of 20 to Thailand in 2006. And then again in 2011, she took a group of 20 to Japan to treat children who were affected by the tsunami. So I just got an email about the application, and I was in a space in my career where I was treating someone who was palliative from Canuck Place and feeling like I had no reason not to go. I had no physical disability or health issue. I'm treating this youth who wants to do everything but is never going to get that chance. And so I figured that I needed to take this opportunity to just go for it and not make up excuses, because I didn't have any, really.
Well, congratulations to you, personally,
Thank you.
for doing all these things for children in our local community, and also, the time and energy now that you're going to go abroad and try to help children around the world. Is this the first experience you've had with going abroad?
It's definitely the first experience I've gone abroad with massage therapy, yes.
Yeah. And how long has this program that contacted you been functioning, going children abroad?
The first one was in 2006 to Thailand.
That was the first one.
Yes.
And is there any sort of feedback mechanism? Is there something is there a website we can go to later and advise our listeners to sort of follow up on this program?
If you want to look at littlekids.com, it's
littlekids.com?
www.little with DD, not a TT.
Oh, DD, not TT.
DD, not TT, and it's kids with a Z or a
Okay.
Z.
Well, don't worry, listeners, we're going to have this on our website. We want you to go there because we want you to become aware of the outreach that some people are doing with their lives to help humans around the world at a very early age. Because the work that you're doing is going to make a difference in these children's lives, I'm sure, and that's going to influence these children later in their life too.
Yeah, and I think the most important part about the outreach is that we're helping to train the staff so that after we leave, they can continue on.
Right. Now, if people want to reach you, how do they find you in the city?
They can email me.
Okay, so do you still have your private clinic?
I do. I'm
Okay.
not currently accepting new patients because
You're busy.
I'm
and
You're
you're
very
leaving.
busy.
I'm busy. I don't have time.
Okay, so we have your email address.
But yes,
And
they
we'll-
can definitely email me if they have any questions. I'd be
Okay.
happy to help them out.
All right.
Maybe refer them. If they also are looking for massage therapists in their area, they can visit the Massage Therapists Association of BC website and click under Find an RMT.
So that's massagetherapy.bc.ca.
Mhm.
Excellent.
All right, you're listening to the Dr. Don Show. Our guest is registered massage therapist Ann Hong, and we're talking about children, but hey, we got adults listening to us too. So if you've got some chronic issues, give a thought about that and give us a phone call right after this. It's all about your health. You're listening to the Dr. Don Show live on AM 650.